Today we're going to talk about Zika virus and birth defects. So what is the Zika virus? Zika is a type of flavivirus, which is a family of positive, single-stranded, enveloped RNA viruses, and it's spread through the bite of an infected mosquito. The most common symptoms are fever, rash, joint pain, and conjunctivitis, all of which are typically mild, and they last for several days to a week after being bitten. Usually people don't die or get sick enough to go to the hospital, but if a pregnant woman is infected, the fetus can be infected as well, and birth defects can occur, such as microcephaly, which is what the topic of this presentation is today. So here's just a visual of how people are infected with Zika. So you can see that someone's bitten, and if they're pregnant, it's passed on to the child, and the cycle just continues with infected mosquitoes biting more and more people. So the outbreak that has been a large topic of the news this year is a big deal because prior to 2015, Zika only occurred in Africa, Southeast Asia, and the Pacific Islands, but recently, in May of 2015, the Zika virus occurred in Brazil, and now it's spread to other places in South America listed here. And it's predicted that the Zika virus will continue to spread, but it's difficult to determine how and where the virus will spread over time. So microcephaly. So this is the birth defect that we're going to be focusing on today that Zika virus is linked to. So this is when a baby's head is much smaller than what is average, and oftentimes they'll have smaller brains because of this, because they haven't developed properly. So microcephaly is also linked to seizures, developmental delay, intellectual disabilities, problems with movement and balance, feeding problems, hearing loss, vision problems, etc. So it can be caused by changes in genes, certain infections during pregnancy, such as Zika, or a woman being close to or touching toxins during pregnancy. So this is just an example of what microcephaly looks like. In the middle you can see a baby affected with microcephaly, and then there's also an example of severe microcephaly. This is also another example of a child with microcephaly. So is Zika teratogen? So first of all, teratogen is an agent or factor that causes the malformation of an embryo. So to be a teratogen, something must fit the following criteria. So there must be proven exposure to an agent that occurs at a critical time during prenatal development. 2 epidemiologic studies of high quality support the association. Careful delineation of clinical cases with the finding of a specific defect or syndrome. There should be an association between a rare exposure and a rare defect, because this implies causation. The last 3 are not essential, but it does not hurt to fulfill these requirements. So need for an animal model that shows teratogenicity, an association should make biological sense, and proof in an experimental system that the agent acts in an unaltered state. So is Zika teratogen? So it fits the first criteria because severe microcephaly and other brain anomalies have been observed in many infants, and are consistent with an infection, a Zika infection occurring in the first or early second trimester of a pregnancy. The second criteria was not met, however the third one was met because many fetuses and infants with presumed congenital Zika virus infection have had a typical pattern, including severe microcephaly, along with other things. Microcephaly is rare and only occurs in 6 infants per 10,000 born in the United States. Zika isn't necessarily rare for women living in Brazil, but reports of adverse birth outcomes among travelers who spent only a limited time period in the area where there is active Zika virus transmission are consistent with Zika virus being a rare exposure. So it fulfills the fourth criteria. So the fifth criteria was not met, however the sixth was. Since Zika virus RNA has been seen in damaged mononuclear cells, like glial cells and neurons in the brains of newborns with microcephaly, live Zika virus has also been cultured from the brain of a fetus with severe brain anomalies after maternal infection at 11 weeks of gestation. Zika virus efficiently infects neural progenitor cells and produces cell death and abnormal growth, such providing a possible mechanism for microcephaly. So that means that it fulfills criteria 6 because it makes biological sense. 7 doesn't apply because it's only applies to chemical exposures, not infectious agents. So how does Zika cause microcephaly? It's not exactly known. As mentioned with criteria 6, it infects the progenitor cells and creates cell death, so that could be a possible way that it causes microcephaly, but also other viruses such as cytomegalovirus that are also linked to causing microcephaly help to shed some light on how Zika might cause microcephaly. So cytomegalovirus attacks stem cells and brain tissues during fetal development, and this prevents the fetal brain from forming properly, thus why they have smaller heads. So there's some data and research about Zika. So a study in Brazil of 88 pregnant women who had onset rash in the previous 5 days were tested for Zika virus RNA. So 72 women had positive tests, and of that 72, 42 women underwent prenatal ultrasonography, and fetal abnormalities were observed in 12 of them, so that's 29%. So that would include microcephaly. None of the 16 women with negative tests had fetal abnormalities, so this suggests also a link with Zika and microcephaly. Additionally, a retrospective analysis after the 2013-2014 outbreak of Zika identified 8 cases of microcephaly. So it's estimated that 1% of the fetuses and neonates who were born to mothers who had been infected with Zika virus in the first trimester had microcephaly, which is 50 times as high as the estimated baseline prevalence. So a possible solution has been offered to this Zika outbreak. They are working on a vaccine, but some people think that this won't be enough, it won't be sufficient to fight Zika virus that is causing a lot of microcephaly. So some small studies in Brazil, Panama, and the Cayman Islands have suggested that genetically engineered sterile mosquitoes can reduce the wild insect populations by more than 90% when they're released to the wild. So what they do to genetically engineer and genetically modify these mosquitoes is they inject mosquito eggs with DNA that contains lethal genes. And then they release the genetically modified males from that batch of eggs so they can then mate with wild females. The reason they use males is because males do not bite, so they don't risk like adding any more lethal mosquitoes into the environment. So the offspring of these lab-weakened males and wild females then inherit the altered DNA and then can't survive, so the population is ultimately reduced. There's still a lot of questions, like whether they'll be just as effective in more densely populated areas, if the reduction in mosquito populations will be enough, etc., etc. So there have been similar methods that have been used with fruit flies in the United States, which leads some people to feel hopeful about the possible use of genetically modified mosquitoes. And sterility also has its benefits because it just wipes the species out of existence, as opposed to adding another species that continues to be a pest afterwards. So here's just a visual of how it all works. So basically just describing exactly what I just said, and this potentially could help to reduce Zika spreading, keep it from spreading, and then in addition to that, prevent more children from developing microcephaly. So they have not used it, and there's still a lot of debate going around whether or not would be appropriate to use genetic modification. A lot of people are still really skeptical. So that's my presentation for the day. Hope it taught you something.